My name is Lorinda Sorensen. I'm a naturopathic physician or a naturopathic doctor and a licensed acupuncturist. And today I'm going to focus a lot on acupuncture, Chinese medicine, but I want to explain those terms, my credentials, a little bit more to you. A naturopathic doctor, and there'll be somebody else coming in a few weeks to talk about this more, is not licensed in the state of Nebraska right now. But many of us who have been trained in the country have been to regular medical schools that are just geared toward natural therapies. And they're 4-year postgraduate, master's level, just like a medical school with a year of anatomy and a year of biochemistry and physiology, and you take boards, several sets of boards. You can order x-rays and do things like that in states that you're licensed. I hold my license in Washington State still, but I chose to come to Nebraska because it was newly legal to practice acupuncture here. In the year 2001, I think, the legislature passed a board which was consumer-driven, I think is the term they use for it, to allow people to practice acupuncture legally with the training that I have, which is a master's level training, 3 or 4 years of a acupuncture-focused program. And so I came here right after that. I'm the second person licensed in the state, and it's been wonderful to have this, to talk to people like you and to actually focus on acupuncture. And that's my real true love, is doing Chinese medicine and acupuncture. So that's me. And you guys are massage students. Has anybody had acupuncture here before? Quite a few, yeah, I thought so. And some of you have probably had acupuncture from a chiropractor. Has anybody had it from a chiropractor versus like some of the people in town? Yeah. So I'm going to talk about that for just a minute as well, because our training as a licensed acupuncturist, so I'm number 2, there's about 10 in the state, means that we have a degree in acupuncture or Oriental medicine or traditional Chinese medicine. There's different ways they word the actual degree. Whereas many other people in the Midwest, not just in Nebraska, whether they're chiropractors, dentists, or some or even medical doctors, usually have gotten their training in a continuing education class. And it's just not as comprehensive with the Chinese physiology, I mean to say Chinese philosophy, about yin and yang and qi. It's some of those programs are really focused on just relieving pain, or they focus on where the points are. They don't really think about the body in holistic terms like an acupuncturist would. So that's just something to remember as not just a patient, I guess I brought it up as a patient, but as practitioners. If somebody you see, you think, oh, acupuncture would be great, you might want to just tell them, you might want to go to a LAC, is the common designation. A chiropractor is great because insurance covers it. That's the main reason people go, I think. And I don't want to put everybody down, but it's that educational standard. It's more of a purist philosophy that I think if you're going to experience acupuncture, you should experience it in the way it was meant to be, and it's been practiced for hundreds of years. So, any questions about that? In America, it was brought back into this area, brought back kind of in this Western world in the 1970s. A man went to China right after Nixon went there and had appendicitis. So he went into the hospital, I think he had appendectomy, so he had his appendix taken out, and he had acupuncture for the pain after the surgery. So he wrote about that here, and that's when America became open to acupuncture again. So it's kind of interesting that a lot of the people here in the Midwest, and on the East Coast too, there's a few, focus more on pain relief because that's how we in America know acupuncture. It's much, much more broad than that. And soon you'll get these handouts. So I'm just going to tell you what these are a little bit. I didn't write these, but these are geared for massage therapists in terms of Chinese medicine terms and acupuncture. And the first one is actually from a board review book for this area in acupuncture. The next one is a complete listing of meridians and points, and it's just little diagrams Now, this isn't the end-all, be-all. It's written in shiatsu terms, which is different than acupuncture. You may experience that, and you may be trained in that, which is really, really cool. But they are different, and we'll get into that because I brought some needles, and you can see them. And I'll teach you a couple of points, too. But this is just some brief explanation if you're interested in it. I know a lot of people kind of use massage as a starting off point to other fields in healthcare. And then the back one is one that's written in terms of Chinese massage, which I don't know very much about, honestly. Tui Na is one of the Chinese names for massage. Shiatsu refers to Japanese acupuncture therapy, hands-on therapy. Tui Na refers to the Chinese name for it. Oh, I think I just got these messed up again. Tui Na's very, very, very aggressive. With hand movements, it's not gentle and relaxing like Swedish massage. Effleurage, it hardly uses any. It uses lots of petrissage, I believe is the term, and tapotement and things like that. And you have to have a lot of hand strength to do it. So there are very few people that focus on it, but there are families that do Tui Na and teach it to their sons and their daughters and generations. The man who first taught my school Tui Na, my class, his family, that's primarily what they did, and they all had an extra pinky on one of their hands. It was kind of like if you had that extra pinky, you were meant to do this. So that's a... They had, oh, I hate to bring this up, but like the little girl that had that extra part on the head, it's just the way the body grew. So yeah, they have a little, it's not functional, a little thing. And it was very strange to look at, but it actually allowed for more friction on the body. Yeah. I want to talk a little bit about some of the theory. I just want to talk a little bit about it. And it gets really confusing really fast. So when I say qi, does anything come to mind for you guys? Energy. That's a good way to look at it. Qi is, yeah, what do you want to? Yeah. When you think of qi, it's like the energy, it's the life force. Our body also has about 10 different kinds of qi, and actually you can break it down into more and more different kinds of qi. So it's something that can be compartmentalized, but the best way to look at it is really kind of like this driving life force. Even things that have been dead, like a rock, or you think they have a qi though too. So life force is not exactly a good term. It's hard to describe. Some people think it's like a vibrational friction, vibration that every living thing, everything in the universe has. So when I say yin and yang, what kind of things pop up for you guys? Anything? That's some good and evil. And you guys are all familiar with the little sign for it, right? Good. So yin and yang, good and evil, black and white, that's a good way to start with it because you can't separate them. It's a dichotomy that lives, they each live within themselves. And I like to think of qi as the driving energy that keeps this thing going. And I really would like to draw something right now because I like to think of the yin and yang cycle in terms of a spiral. It's got that shape to it, if you think about it. Yeah. Oh, I don't know if it'll help. I'm going to use this for just right now. And this. So just to show the video camera, that's what it looks like. And I'll use this for a second. So yang is the white part. Yang is active. It's considered very light and very warm and dynamic. Yin is the dark part. It's considered very sedating, cool, nighttime, night and day. You know, time we can't really think about it without thinking night and day and thinking of the clock and separating it. But these things go around. You can see how it's got a little bit of almost a dynamic movement to it. Yeah. And the little dots Nobody really shows this because it's too small to see, but the little dots, so that's the yin within this yang part that's white, but really in reality, this is another yin and yang symbol. It just goes on and on and on forever. And the same thing with the yang within the yin. Like this time of day, so it's 4 o'clock, it's going to be dark in a couple hours. This is a yin time within a yang time. So you can't separate them. In a human body, you have both. So people can be predominantly one more than the other, and those symptoms or situations can come up. So I like to draw when I'm talking. It slows me down and helps me concentrate. Yin is the dark part, yang is the light part. And then let's say this is a person. So let's look at the body in terms of yin and yang to compartmentalize, but you can see in the end how the relationship is going to be working. In our body, the Chinese view the kidneys as being the source of all the yin and yang. In Western medicine, I think the closest thing that might relate to it would be the brain, which the brain is very, very dense, and it has a lot of what they call, okay, I'm starting to get off on philosophy. I get a little geeky with this stuff. Jing. Jing is, it's very similar to kind of like our marrow, our essence, our genetic makeup, if you look at it that way. And the Jing is stored in the kidneys, and the kidneys are the foundation of all the yin and all the yang, but they are a yin organ because they're dense and solid. In Chinese medicine, the yin organs play a little bit more important than the yang organs, but they're paired. Everything has a relationship with each other. So the urinary bladder, which makes sense, and I'm just going to put UB, is the paired organ for the kidneys. Now the kidneys work a lot with the heart, both in Western medicine and in TCM. TCM refers to traditional Chinese medicine. Some people call it Oriental medicine. Some people are starting to call it traditional East Asian medicine. There's a few different terms that people are throwing around, but TCM is the classic term, so if you hear that, that's what it is. But TCM and Western medicine both view a connection in Western medicine and blood pressure. You guys have had some physiology, right? It's not necessarily blood pressure in TCM, but it's the connection between the emotions and some water metabolism as well. The heart is paired with the small intestine, which sounds like a really, really funny pairing to most people. But a lot of it is the way I try to explain it so that it makes the most sense. Our heart is here. Our small intestine is very, very close. If you took out that diaphragm, they'd be right next to each other. And if you have heat in your heart, if somebody say, heat in the heart can be referred to, if you think about somebody that's very, very manic or has a really super high fever and maybe going into convulsions, can be transmitted via the small intestine to the urinary bladder and to the kidneys and then disseminated throughout the whole body. Any questions? Does this sound interesting or does it make sense?
Very interesting.
Okay. The heart, I'm just kind of going through. This order is not necessarily set in stone. I change it every time I talk. But the next organ, yin organ, that's really, really important is the liver. Now, we all have heard all kinds of natural therapies about things to do for the liver. You have to clean your liver. And in Chinese medicine, the liver and anger has a gigantic, gigantic connection. The liver is what, qi, I like to think as qi is keeping this going around. So the liver is what circulates the qi throughout the rest of the body. When emotions start to affect the liver, qi gets stuck. You can have problems in emotions, you can have pain, you can have disease. Qi stagnation is very, very prevalent in our culture. It's either the root cause, sometimes it's not, but it's a symptom that almost all of my patients have sometime in the, month, I guess. If I have people coming in once a week, I'll see chi stagnation about twice of that time of the treatments that I really, really want to treat. Even alcohol can cause chi stagnation. Makes sense because alcohol goes straight to the liver. The paired organ is the gallbladder. These yang organs basically have the same function, whereas these yin organs in Chinese medicine, like liver controls the qi. Well, in Western medicine, there's nothing like that we can say happens. Another big one is the spleen. And this is another confusing element because the spleen in Chinese medicine is incredibly important and way bigger than it's given in Western medicine. In Western medicine, it just filters the blood, takes out those nasty red blood cells. In Chinese medicine, it actually does most of the functions of the pancreas. So digestion is right there. If people have poor digestions, they usually have problems with the spleen. And of course, its paired organ is the stomach, but spleen gets injured by anything that can injure digestion, food, emotions, even studying while you eat. That's something for students to remember is something that injures the spleen. Most students, because they're thinking so much, take energy away from that spleen digestive function, even if you're not eating. And you can have deficient spleen qi. I have usually if I take people's pulses when I'm doing student lectures, and they have very, very similar pulses. It's like kind of weak in certain positions, and that's one of the reasons why. And I've been there, so it's it's a problem. Okay. Next organ, the lungs. The lungs do similar physiological function. They do something called moisten the body and the qi. The liver circulates the qi, but the lungs kind of disperse it in a very moistening way. And the lungs and the spleen work together quite a bit in that fashion. The spleen likes to be moist and warm. It sends that warmth to the lungs. The lungs circulate it over the whole body. I learned this is like an umbrella and everything's misting. And if you have too much dryness in your body, the lungs can be a problem with that. Its paired organ, which is kind of confusing, kind of makes sense, is the large intestine. Both of these organs are organs of excretion of waste. Now the other organ pair is unique to Chinese medicine, the pericardium, which is just that fatty layer of tissue that surrounds the heart.
That also known as like the triple heat warmer or something.
Nope, that is the sanjiao. San is three, the way, I'm not saying it right, I don't know Chinese, but triple warmer, triple burner, jiao refers to the burners. Like the lungs are in the upper burner, the spleen is in the lower burner. Actually, the middle burner. The kidneys are in the lower burner. And they work together, and when they work together, they're called the sanjiao, or the triple burner, or the triple heater, or whatever you want to call it. I call it the sanjiao just because it's a little bit shorter to write, and it's kind of ingrained in my head that way. So this has no structure at all in Western medicine. They have no idea how to interpret that. But you can think of it as like the connective tissue and how things get circulated through the body. Vessels have connective tissue in them. There's connective tissue around nerve sheaths. That's one way. Some people refer to it only as water metabolism. So even in Chinese medicine, it's not clear. The pericardium has much more function. It protects the heart. In traditional hardcore TCM, what they teach in China right now, pericardium has very, very little function at all. It just protects the heart from illnesses. In certain kind of esoteric acupuncture functions, pericardium has much more to do with emotions. It protects the heart by taking on those emotional things. And one of the ways I work with this system is the pericardium is about interpersonal relationships, husband, wife, boyfriend, girlfriend, mother, child, stuff like that, one-to-one. The Sanjiao is about social situations, like your class, like your job department, like your whole family. Imbalances show up there. So these are the main organs. A couple of other things. Can I erase this? The kidneys have connection to the brain and to the uterus. These are what they call curious organs in Chinese medicine. So that is a brief explanation of a type of theory in practicing acupuncture called Zongfu. If you hear that, I think one of the pieces of paper you'll get will describe it. Zong means yin, Fu means yang. I think that's right. Yeah. And it's a way of looking at the body in terms of the organs. Spleen qi is deficient, stomach qi is rebelling, stuff like that. Stomach qi likes to go down, spleen qi likes to go up and back again to that circle and spiral. Qis have directional things, and I'd love to talk about it more, but I'll get confused and it'll all get confusing to everybody. Another way that is a very cool way to look at Chinese medicine is 5-element way. And you'll get a tiny bit of an explanation, and it's going to be this graph right here, which is really cool. When you get this, look at this. It's a way of separating the body and life into even more little things that relate to each other. And now that you know the organs fall under those things. Wood is the liver and the gallbladder. Fire is the heart, the small intestine, the pericardium, the Sanjiao. Earth is the spleen and the stomach. I use a lot of abbreviations, so if nothing, you just ask me. Metal, which is kind of when you think about elements, there's not a lot of metal. It's kind of unique to Chinese medicine. It's the lung and large intestine. And then water, this one makes a lot of sense, is the kidneys and bladder. Just like that picture of the yin and the yang, these create each other. We are in winter right now, which actually is a very water time. Kidneys, they don't necessarily like to be cold. They tend to be cold. You can survive in the winter in this time really well. Springtime is wood. You can kind of see where I'm going with this. Summer is fire. Earth, there's a couple of different ways to look at that. Earth is the center. It's our center. So some people look at it as the last 10 days of every season. There's that interchange between the seasons. That's the earth time. Some people look at it as being an Indian summertime, which here we get a lot of Indian summer type of things. So I think this is a very earthy area, not just from agriculture, but from the climate as well. And then fall refers to metal. And this can be separated into body parts. Eyes are the wood. The liver opens up into the eye area. Fire refers to the tongue. Earth is the muscles and the actual lips, although the tongue and the lips, sometimes personally I get confused. Metal is the nose. Kidneys in the water time is the ear. So that's just a different way to look at the body. And 5-element acupuncture, it's really, really cool, and there's not many people who practice it. They do it more in Europe. It's very emotional based. It's kind of like the psychology of the psychological acupuncture. I think a lot of things can be treated with 5-element acupuncture in a different way than just regular acupuncture can. Okay, so I want to show you a meridian. So this is the lung meridian. I'll just name a couple of, start with kind of describing the points, and then I'll show you a couple of points. The lung meridian is where all the books start. The lung meridian is considered to be very, very close to what we call external chi, which some people call wei qi. It circulates on the outside of us, and it helps our defenses, immune system, T cells, B cells, stuff like that. It starts on the hand, and it goes up, and then it connects with its paired partner on the face. Now, I get nervous when I talk and I screw things up. Okay, they connect on the hand. So they all connect. The meridians are kind of like one big long meridian. You can't really get that from these little pictures, but they all connect. They all connect at interesting little spots too. I want to tell you about a couple of points. And this one is used for headaches. Do you guys know that headache point? Mm-hmm. So it's large intestine 4. And I'm going to show you my way to find it, which I think works really well. And I think it's a little bit more effective. You can take your thumb, and you can teach people this too. This is a really easy way to do that. That first crease, you line up with the web of the other hand, and then you roll it in. And I locate this point very close to that joint and very close to the bone. So you want to actually press in the bone. You can massage the area, the tissue outside of it. I don't think that's quite as effective. It can be painful when you get a little closer to the bone. So that's one you guys can know.
Does it smart a little bit there?
Yeah, it does for a lot of people. It helps headaches. It's a major, major chi mover. It's actually contraindicated for needling in pregnant women. So when you're doing pregnancy massage, you might want to teach them that in only the second trimester, just because it's safer then. And it can stimulate uterine contractions. It helps with bowel movements, of course. It's a large intestine point, but just because it's on that channel, it doesn't just do that. So that's a really good one. But one that's really safe to use in pregnancy is the motion sickness, morning sickness point. Have you guys heard of that? The bands? Oh, yeah. The pericardium 6. Acupuncture points are proportional to body parts, bony landmarks. Your pericardium 6 will be different than his. So what you would do when you find points, and this is what a lot of acupuncturists spend time practicing and learning, is you look for the crease, that antecubital fossa crease. So between this crease and your wrist crease is what they call 12 sun, or you can look at that as an anatomical inch. Divide that in half, that's 6. Divide that in half, that's 3. So pericardium 6, or the morning sickness point, is 2 sun up from the wrist crease, about 2 anatomical inches. Once you find out your anatomical inch, then you can kind of get a sense of where things are. And it's in between 2 tendons. It's not the best place to massage, but it is effective. Any kind of like nausea, vomiting, indigestion, right in there.
Kind of like a hole in there.
Yeah, some people have a hole in there. There's the palmaris longus tendon, which about 20% of the people don't have. When they don't have it, there's a big hole there. When they do have it, it's not as big.
That doesn't feel like there, is it? There's a pressure.
It can be for some people. It's not as sensitive to pressure just from your finger. It's very sensitive to needling, actually. Yeah.
Is it good for motion sickness?
It's excellent.
Excellent.
Yeah. It's a awesome point. It's you can hold it. I hold it. When I get really nervous, I will get stomach problems, so I do it a lot for myself. The point is good for that. It's also, just to introduce something else to you, there are what they call extra meridians. I don't know if any of those handouts touch on it. They're the meridians that were forming when we were fetuses, when we were in utero. as you are born and you start to move around, the other meridians, that's when they take on and get developed, and the other ones kind of go away, but there's still points. And pericardium 6 is what they call a yin wei mai point. Those are points that focus more on just the sides of the body and transporting all that prenatal essence through. They're really important in women. Not so important in men because they have more of a link to that uterus area too. So I'd like to take a little case, like a 10-minute case for somebody, and do some needling, and then somehow do some needling on everybody. I think I have enough needles to do one needle on everybody here. But if I can take like a 10-minute case, I can just briefly show you tongue and pulse too. And how, I don't know if I'm the best judge to look at for practicing acupuncture, but how an acupuncturist would practice. And if you have somebody with musculoskeletal pain, I'll just do distal points. Toss up. You want to go? You guys? Okay. Okay. Go ahead and hop up there. And I'm assuming that you're willing and open to talk about this in front of everybody. So, what's your complaint?
I'm having back pain, mainly my left scapular area, my rhomboids. I don't know if it's my subscapularis or...
How long have you had it?
Past couple months.
Do you know what caused it?
No.
Okay.
I get like a numbing effect back there. Like if I'm washing dishes or if I get into this kind of position, it gets numb.
Can you show me? Like, can you go back that far? Is it
It's
all the way down?
yeah, right.
Okay.
And this
Anything on top then?
right inferior, like inferior scapular.
But nothing up here?
No, not really.
Okay. And any radiation anywhere else in your body, down your arm, down the side, your flank, of anything? Because you mentioned numbness. What about
I get numbness in the back area.
What about pain?
It's painful, but it's more like a numbing. I can feel it's there from the numbing, but it's not like a huge pain. The numbing lets me know it's there.
How old are you?
25.
Okay. Does it change at all with the cold that we've had or anything with your menstrual cycle?
No.
Okay. Any other musculoskeletal pain that might be related to it or that you've had on and off in the last year?
Well, I was in a car accident a couple years ago, and I had a lot of damage in my neck, traps.
On that side or both sides?
Both sides.
Okay. Okay. Yeah. The trap area is not too bad. See, the rhomboid area right there, that's actually kind of a tricky spot to treat because it can seem to come up with people for no special reason. Mm-hmm. This is just from clinical experience. I've had a couple of people that I've really, really worked on. I've done local points, I've done distal points, and they still complain. I usually do a lot of meridian therapy. The urinary bladder meridian, it's the longest one in the body. It goes, if you want to turn around, I'll just show them, and then I'll do some pressure points and see. So urinary bladder has one pass down the back. So how's that? Is that close to it?
Yeah.
Okay. And as it go down,
Yeah, like right in there.
Okay. And then it goes down a little bit more. The urinary bladder does a second pass. And all of this is between the spine and the scapula. And the spot that she's describing, these back shoe points, they call them shoe points or transporting points. It's actually really close to the liver point. So why don't you go ahead and sit down. So actually with that area, I totally look at blood. The concept of blood is a little different. It's just deeper than just blood that circulates. And then I'd look at the liver. So I'm going to go ahead and take your pulse. And where are you at in your cycle right now? And are you on the pill at all?
No.
Okay. The pulse is taken in 3 positions on both sides, and the positions refer to the organs. They're not any kind of exact match. I'm on the right side, which the first position is the lung, the second is the spleen, and the third I use is the pericardium pulse. But when you're taking the pulse, you want to check for the contour, the speed, the amplitude, everything you would check for in a pulse, but more. Pulse taking takes years to learn, unfortunately. I wish it would be easier. As I press down really hard, it kind of disappears. As I go up, it's a soft pulse, but underneath that softness is an edge to it. Wiry pulses, which are like a guitar string, refer to that stuck liver chi that I mentioned before. And so over here, the left side is the heart, the liver, and the kidneys. And this pulse is just slightly tighter. It's got a little bit more of a constraint to it. And it's also got a little, I call it a bump, which is a slippery quality, and that can indicate dampness. That humidity that we get in the summer, you can have that inside your body, and it's not always good. You want the body to be moist, but you don't want that moisture to stagnate, to get stuck. Can I look at your tongue? And you're 23?
25, 26.
Okay. And underneath? And back out? And the tongue has areas for those organs as well. The sides are the liver. Now hers, one more time. Her tongue color is pink. It's great. You can put it back inside now. There's little papilla, and they're a little bit redder for most people. If the tip has too many papilla and they're too red, that's heat in that upper burner, heat in the heart. The sides are the liver and the gallbladder. The middle is digestion. The back, which can be really hard to see, refers to the kidneys, and even back behind that, you can see an element of the uterus in there. So her tongue body color, she doesn't have much of a coat, a nice coat. It's pretty healthy tongue. And a lot of people in their 20s will have that nice healthy tongue. But the sides have a slight, very, very slight yellow quality. So I would treat you as having a liver problem and actually what I would call a liver blood deficiency and liver chi stagnation. So you want to do some points?
Sure.
Cool. And then do you mind, while you're laying down, I'll show you the needles and then I'll pass them around to everybody else? Okay. Legally, you have to use clean needle techniques, and in this state, always use prepackaged, sterilized, disposable needles. Okay, there's one. Ooh, that's kind of big for you. And maybe like a blanket or something rolled up. Yeah, I think so. It just looks like you need a little bit more to be comfortable. Okay. So I'm going to do a classic combination of points called the 4 gates. Liver 3 and large intestine 4, which large intestine 4 is the, what do you guys call it? Hokyu? That's how I learned it. Hoku. Yeah, that's pretty close. Everybody calls it a different name. Now, liver 3 on the liver channel, which starts on the foot, goes up. Yin channels always start either on the chest or the foot. They go towards the heavens. Yang channels go towards the earth. It's exactly like large intestine 4, but it's on your foot. So it's in between the big toe, the hallux, and the second toe. If you guys want to find it on yourself. You just take that web, follow it till you can't go anymore, and it's usually right in there.
Would you not do anything at her shoulder, the scapula?
If she was in my office, maybe, yeah. I don't get too local points for demos, unfortunately. Go ahead and put both hands there. And I actually find that distal points work better for back pain. Actually, I'll do a shoulder point for you. If this is what they call an extra point. It's on a meridian, but it's not one of the classical points. Spleen 9 is right below the medial tubercle of the tibia. So you go down about 1.5 inches, 1.5 sun, and you find a tender point.
Does it hurt, like acupuncture?
This is going to
Get a little
Well,
scared.
no, I have tattoos that
No, you can handle it.
yeah, so.
Can we hold your hand, Liz?
No, I'm good.
Some people find that they feel the needles going in. It's a needle. You'll feel it for the most part. Let me pass around here.
Have you ever sewn before? Needle and
No.
thread? That's all it
If
feels
I saw what?
like sewing needle and thread.
Uh-huh.
You poke yourself.
Okay, I'll pass around this needle. It's a fairly big needle in diameter, as well as, this is a 1.5 sun, 1.5 inch long needle for the abdomen for people that have bigger body parts, which for you, I would only use it on the abdomen or in the gluteal region. So go ahead, and if you poke yourself, let me know. And we can wash. It's clean. Usually I try to save my demo needles so you can see them. But different needles have different sensations. So for you, let me...
How far do you stick the needle in?
Not very far.
I was thinking that myself, Liz. I want to know too.
I'm thinking like this goes into your abdomen, like.
It's proportional to body size as well. To her body size, each point has a range of a depth that is acceptable for that point. These points, not very far. The point that you can go pretty far in is gallbladder 30, which is in that gluteal sciatic region. Are you nervous? Okay. So yeah, when people are getting, you guys as massage therapists will, if you know an acupuncturist eventually, you can suggest it. And a lot of time, this is what I hear from my massage therapist friends. People are just afraid to go in. And I get those people a lot. I've had people with needle phobias actually, too. And they were very, very amazed. And they don't always come back. But actually the needle phobia people, they like the feeling. They're not afraid of it anymore. They're not afraid of acupuncture anymore, even though they're still afraid of needles. Does that make sense? Okay. But I'm going to have you take a couple of really big, deep breaths. And again, nice deep breath. And as you exhale, you'll feel a little pinprick right there. Do you feel it?
I felt like a tap tap, but
Yeah. So there's a way to do some needling. There's a sense that you want to get. You want to get Dutchy, the big chi in the needle. And usually the patient can feel it. Sometimes they can't feel it, but I usually have to feel it somehow. And it's a sense of the needle grabbing against me. It's like I pull on it and the body wants it, doesn't want to let go.
I feel like a twitch, like just.
Yeah, that's pretty common. Do you feel it when I move it?
Yes.
Okay. And what does that feel like, that twitch?
No, that was more.
Didn't like it, huh?
And exhale, there's a pinprick. Sometimes I do that telling people to breathe every time. Sometimes I don't.
It's not as bad as that was.
Different size generally have different sensations. I locate a point by the proportions, you know, this is where this is, but they also have a feel. They all feel kind of sinky, that's how I describe it. Go ahead and take a deep breath. There's the pinprick.
So you're turning it.
I'm twisting it. Yeah.
I can't even feel that. I didn't even feel it going.
Yeah, a lot of people. But this one's pretty close to having the chi. Little. Actually, now this one has it. So sometimes I go back and make sure. That one doesn't have it quite so much. Bigger needles do get the chi a lot more. Chinese practitioners use fairly big needles quite a bit.
See, I thought that one would hurt. Being
Would-
close to my knee area.
I might see, my sinky feeling might be a little bit different from where the point is for you. Go ahead and take a deep breath. And I'm just going to lean over you to do this last one so I don't get tangled up in the cord, if you're okay with that. And that way everybody else, I guess, can see it too. Okay. And exhale.
They go in pretty easy now.
I felt
They go
that
in
one
pretty
more than I
easy.
felt uneasy.
I use guide tubes. I find that they desensitize the skin area just a little bit. And I also find for myself, I like guide tubes better when I'm receiving acupuncture.
What's that, a guide to?
I call it a guide tube.
Oh,
It's just a little hollow tube. Yeah. Some come a little bit cheaper because then you don't have to use so much material to package them. These are ear needles, and I'll take this one out and pass it around, and you can see how they're packaged. A lot of people in New York State, city, it was totally touted, I think in the 70s and 80s, that acupuncture is effective for getting people off of drugs. And it's been studied very, very well. Doesn't work by itself. I think it works good when you're using counseling, when people are ready to quit anything. I work with people when they're stopping cigarette smoking. Yeah.
So it helped with the craving issues?
It helps with the craving issue, yeah. Let's see what else I can show you. So we'll just spend the rest of the time showing other stuff and then let her sit for a few minutes. After, you know, when they hurt, I like that sensation to go away. So what's it feel like?
It feels like there's a needle stuck under my skin.
Does it feel
Like I just
like it feels pretty
like
tight
numb
and
or-
stingy?
yeah.
Numb is a quality that you actually want when it feels pinchy and nervy without the numbness. So at some points, you know, I'll take out right away. Large intestine 4 is a point because it's so tender.
Is that the large intestine?
I usually leave that one in. Pericardium 6, that one I showed you too, that's another point that I leave in. I'll take it out a little bit, like reduce it. And she's already responded. She's got a little redness around both large intestine 4s, big time. And it's just been a few minutes, although you are in front. Feet, they're so much colder, it might not come right away. So when a bug bites you, you get that histamine reaction, sometimes swelling. The body looks at the needle as a foreign object, but the body's responding to the needle. So I like to see it. I like to see that little redness. I don't like to see swelling like a hive or a wheal. The redness is fine. Let me show you some other fun stuff. Cupping. You guys have probably heard of cupping. It's an element of a massage technique type of thing where you're actually pulling. You create a vacuum in this cup and you run it along body parts. If you guys want to look at that. Yeah.
I've heard of a technique that uses coins. Is there a technique that uses?
The coins is gua sha. Gua sha is scraping. This is a gua sha tool made out of horn. So it's just,
Is that kind of like the spooning
Spooning.
where those people?
Exactly. Yeah, exactly. And
There's these people that did the spooning on their children, and it leaves a big bruising.
Oh,
It's like they got
And that happened a couple of years
and
ago
their kids
here.
got taken away from them because they thought they were being abused until they realized what they were actually doing.
And I'm from Seattle, and that happens every few years in Seattle, where somebody will cup, somebody will coin. They use, big coins. They use spoons. They use things like this. You can feel it. Not everybody bruises. When you do it really aggressively, it bruises, because you're wanting to bring heat out of the body. Heat gets trapped into the body, and it creates infections. Or it's kind of like an infection. When you look at infections and high fevers, that's heat trapped in the system. This is a way to get it out. So really, they were trying to take care of their kids, not abuse them. But it happens everywhere, unfortunately. Do you have another needle?
Can you explain why the glass, how that works?
I can show you if somebody has a match and somebody wants to see it.
I guess he knows how to do it too. John?
I'm going to go ahead and take these out, if that's okay with you. Cool. Does anybody want to have the cupping done? Yeah, a lot of people can't feel them taken out. When I'm doing treatments, I leave the needles in for at least 20 minutes. I like to leave the room for 20 minutes. Like sometimes I'll put the needles in and I'll do cupping or moxa, but I still like to leave because I think people relax a little bit more. Things happen when you get treatments in massage as well. You can have big releases. It just depends on where the patient's at. I'll stay with them if they need me with them, but I think if you can relax with the needles in, it goes a little bit deeper.
What is it when they use heat with the needle?
Moxibustion is generally what they're doing. Okay, you're all free.
Sure you didn't get one in there?
So with the cupping, I'll work on the cupping first, then I'll show you the moxa.
Are you done?
Yeah. And if somebody wants to do the cupping and wants to expose their back, that's the best place for it. If nobody wants to do it, we'll just do some. Okay.
Oh, you got somebody?
How did that feel?
I couldn't feel it in my feet, and this is the one spot I could feel it. And even when you took it out, I felt a lot of pain, but not pain, like you couldn't really feel it at all. You can't.
Does it feel better right in your shoulders though?
I just won't move it around very much.
I guess, yeah, I guess it does. I didn't really think about it, but it was definitely an experience.
And it's always kind of
But
clustered.
I think I worked myself up to expect more out of, like more pain, but it wasn't at all. It was pretty neat.
Should I sit this way?
Yeah. Yeah, sit this way. Is it okay that you don't see? You'll feel it though, so. I think cupping is the closest thing to massage that we can do. Sorry. No, so what I want to do is induce a vacuum in this cup, place it on the body. I'm just going to put it right here. Actually, a little bit more lateral. And for that, I usually use a alcohol-soaked cotton ball. Now, this is a swab that's been packaged, so I'm not sure exactly how much suction I'll get. And sometimes it depends on how quick I am. This is called fire cupping, and I think it's the best kind. So this is a loose, which is fine because you're pregnant, right? Yeah, I don't want to do I'm really conservative with pregnancies. I I'm very open and pro-choice, but I don't want anything to happen, so I'm pretty conservative. How far along are you?
8 months.
Yeah. But can they come up and see? You can see how this is pulling on the skin just a little bit, but this is, and you can actually see it's stuck. There's a vacuum inside there. You can run it along that urinary bladder channel and look for the spots that either show up purplish and bruised looking or red as a diagnostic technique. A lot of people do that. It dredges the meridians. Some people like it with back pain and
For stuck chi, you find something there or no?
yeah. Yeah, generally. When people have stuck chi, what we call an excess pattern, there's too much of something somewhere. They can have deficiency someplace else, but there's too much, and that's the overriding presentation. Those are the people that generally bruise with cupping, with the scraping. When people are really deficient, they have too little of something, those people generally don't bruise, even with hard, excessive techniques. So that can be where the diagnostic criteria come in. So, the best way to move this is with oil, and I'm not going to do that, if that's okay with you.
Yes.
Cool. And there you go.
Wow.
Thank you.
So that just works on that one area of the back?
You can do it all over. I love showing the technique stuff. This is a moxibustion stick. Moxibustion refers to the technique name. The name of the herb is ai. I'm slaughtering that Chinese-wise. It's Chinese mugwort, very similar to sagebrush. When you're using sage to smudge something, it's in that same family.
How about the mugwort that girls here in America?
It's a little different. It's very similar, but a little different. If I were to light this, it smells a lot like marijuana. So
But it's not.
it's not. It tends to give me a headache if I inhale too much smoke. So they compress it, and then they do something chemical to it, which is a little bit more processed, to make it smokeless. And I use a kind that has some other herbs in it, and it smells a lot better. You just see like a little wave of smoke. And this I do for a lot of musculoskeletal things because it helps relax the area. Or when people are really, really tense about acupuncture, I do a lot of this. And I do a lot of this now because it's so cold. It's invading our bodies a little bit more than we'd like. Even if, we don't complain about it, I'm still seeing a little bit of it. So these are a couple of ways to do it. And then you can get the herb and make little cones. If you guys want to look at how it's kind of all smushed together. And this is what you use on top of the needle. You make a little stick thing, kind of like a hat, which it's kind of complex, and I don't do very much of it in my office as well because my hands are usually really, really busy when I'm doing that. But I'll also use that kind. I use moxibustion directly on the belly button with some salve or maybe a slice of ginger or something like that.
What's that called?
That's Chinese mugwort, but
That is the mugwort.
yeah, everybody says moxa, and they refer to the herb as moxa. It's the name of the technique. The herb is called something else. But when you say moxa, it could be anything using Chinese mugwort. I have little tiny things that get stick on. I like those a lot because they're really safe.
Tobacco filters on them.
Cigarette filters,
Thank